Your doctor orders the same basic blood panel every year, tells you everything looks fine, and sends you on your way. Meanwhile, you could have pre-diabetes, thyroid dysfunction, or chronic inflammation brewing, and you'd have no idea because the standard tests completely miss them. Here's the truth. The basic annual physical blood work is designed to catch disease once it's already established. It's not designed to catch problems early when they're easiest to reverse. Today, I'm breaking down the 5 blood tests everyone over 30 should be getting. Tests that reveal what's actually happening in your body before you develop full-blown disease. Let's get into it. So, here's why this matters. After age 30, your body starts changing in ways that increase disease risk. Your metabolism slows, inflammation increases, hormone production shifts, and cellular damage accumulates. But here's the thing. These changes don't happen overnight. They develop gradually over years, even decades. And during that time, standard blood work often shows normal results because it's only looking for advanced disease states. What you need are tests that catch metabolic dysfunction, inflammation, and hormonal imbalances in their early stages. When you can actually do something about them through lifestyle changes, nutrition, and targeted supplementation. The 5 tests I'm about to share can reveal problems 5, 10, even 15 years before they'd show up on standard testing. And more importantly, they give you actionable information, things you can actually change. I'm going to tell you what each test measures, why it matters, what the optimal ranges are, not just the normal ranges, and what it means if yours is off. Let's start with number 1. The first test is actually 2 tests that work together: fasting glucose and hemoglobin A1C, or HbA1c. Most doctors order fasting glucose as part of the standard panel. That's good, but it's not enough. Fasting glucose is a snapshot. It tells you what your blood sugar is at one moment in time. HbA1c tells you what your average blood sugar has been over the past 2 to 3 months. You need both. Here's why this matters. Type 2 diabetes doesn't just appear overnight. It develops through stages. First, you develop insulin resistance. Your cells stop responding well to insulin's signal. Then you progress to prediabetes, where your blood sugar is elevated but not yet diabetic. Then eventually, if nothing changes, you develop type 2 diabetes. The problem is fasting glucose alone might look normal even when you're already insulin resistant or pre-diabetic. Your pancreas is just working overtime, producing more insulin to keep your blood sugar in the normal range. But HbA1c will catch this earlier. For fasting glucose, the standard normal range is usually under 100 milligrams per deciliter, but optimal is actually 70 to 85. If yours is in the high 80s or 90s, that's a warning sign, even though it's technically normal. For HbA1c, normal is considered under 5.7%. Prediabetes is 5.7 to 6.4%. Diabetes is 6.5% or higher, but optimal is actually under 5.3%. If you're at 5.5%, you're technically normal, but you're on the path toward metabolic dysfunction. Why does this matter after 30? Because insulin resistance and metabolic dysfunction accelerate after age 30, especially if you're sedentary, carrying extra weight, or eating a high-sugar diet. Catching this early means you can reverse it with lifestyle changes. Catching it late means you're managing disease for life. If your numbers are elevated, focus on reducing refined carbs and sugar, increasing protein intake, adding strength training, and improving sleep. These aren't just general health tips. They specifically improve insulin sensitivity. The second test is a comprehensive lipid panel. Notice I said comprehensive, not the basic panel your doctor usually orders. The standard lipid panel measures total cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides. That's useful, but it's incomplete. It doesn't tell you about LDL particle number or particle size, which are actually more predictive of cardiovascular risk than LDL cholesterol alone. Here's what most people don't understand. It's not just about how much LDL cholesterol you have, it's about how many LDL particles you have and what size they are. You can have normal LDL cholesterol but high particle number, which means increased cardiovascular risk that the standard test completely misses. A comprehensive lipid panel includes LDL-P, that's particle number, or ApoB, which is a marker for the number of atherogenic particles, the ones that actually cause plaque buildup in your arteries. It also measures small dense LDL versus large buoyant LDL. Small dense LDL particles are much more dangerous because they can penetrate the arterial wall more easily and cause inflammation and plaque formation. Large buoyant LDL is less concerning. For triglycerides, standard normal is under 150 milligrams per deciliter, but optimal is actually under 100, ideally under 70. High triglycerides are a marker of insulin resistance and increased cardiovascular risk. For HDL, your good cholesterol, higher is generally better. For men, you want at least 40, ideally above 50. For women, at least 50, ideally above 60. Your triglyceride to HDL ratio is also incredibly predictive. Divide your triglycerides by your HDL. Optimal is under 2. If it's above 3, that's a significant red flag for insulin resistance and cardiovascular risk. Why does this matter after 30? Because cardiovascular disease develops silently over decades. Plaque starts forming in your arteries in your 30s and 40s, but you don't have symptoms until you're in your 50s or 60s and have significant blockage, or until you have a heart attack. This test catches the process early. If your comprehensive lipid panel shows issues, the solution isn't automatically statins. Often it's addressing insulin resistance, reducing inflammatory foods, increasing omega-3 intake, exercising regularly, and managing stress. The third test is a comprehensive thyroid panel. And I emphasize comprehensive because most doctors only test TSH, thyroid-stimulating hormone. That's not enough. Your thyroid controls your metabolism, energy production, body temperature regulation, and much more. Thyroid dysfunction is incredibly common, especially in women, and it often goes undiagnosed for years because doctors only look at TSH. TSH is produced by your pituitary gland to tell your thyroid to make more thyroid hormone. If TSH is high, it suggests your thyroid isn't producing enough hormone, hypothyroidism. If it's low, it suggests your thyroid is overactive, hyperthyroidism. But TSH alone doesn't tell you what your actual thyroid hormones are doing. You need to measure free T3 and free T4. These are the actual active thyroid hormones. T4 is the storage form of thyroid hormone. T3 is the active form that actually does the work in your cells. Your body converts T4 to T3, but stress, nutrient deficiencies, inflammation, and other factors can impair this conversion. So you could have normal TSH and T4 but low T3, meaning you're functionally hypothyroid even though standard testing says you're fine. For TSH, the standard range is usually 0.5 to 4.5 or even 5.0. But functional medicine practitioners consider optimal to be between 1.0 and 2.0. If your TSH is 3.5, you're technically normal, but you might be experiencing symptoms of hypothyroidism: fatigue, weight gain, brain fog, feeling cold. For free T3, optimal is generally in the upper half of the reference range. For free T4, mid-range is usually good. You should also test thyroid antibodies, TPO and thyroglobulin antibodies, because you could have autoimmune thyroid disease, Hashimoto's, that hasn't yet caused full thyroid dysfunction. Catching this early allows you to address the autoimmune component before significant damage occurs. Why does this matter after 30? Thyroid function naturally declines with age, and thyroid problems become much more common, especially in women approaching perimenopause. Symptoms like fatigue, weight gain, hair loss, and mood changes are often dismissed as just getting older when they're actually thyroid dysfunction. If your thyroid numbers are off, work with a doctor who understands functional thyroid optimization, not just disease management. Nutrient support, selenium, zinc, iodine, vitamin D, stress management, and addressing gut health can make a huge difference. The fourth test is vitamin D, specifically 25-hydroxyvitamin D. Vitamin D deficiency is epidemic, especially in people who live in northern climates or spend most of their time indoors. And vitamin D isn't just about bone health. It's crucial for immune function, mood regulation, cardiovascular health, metabolic health, and even cancer prevention. The standard reference range for vitamin D is usually 30 to 100 nanograms per milliliter, with deficiency defined as below 20. But optimal for most health outcomes appears to be 40 to 60, maybe even higher. If you're at 32, your doctor will say you're fine. But research suggests that for immune function, mood, and metabolic health, you want to be at least in the 40s, ideally 50 to 60. Most people need to supplement to reach optimal levels. You can't get enough from food, and unless you're getting significant sun exposure on bare skin regularly, which most people aren't, you're probably deficient. The amount you need varies based on body weight, genetics, and current levels. Some people need 2,000 IU daily, others need 5,000 or even 10,000 IU. The only way to know is to test. And here's something important. If you supplement with vitamin D, you should also take vitamin K. Vitamin D increases calcium absorption, and K2 makes sure that calcium goes into your bones and teeth instead of soft tissues like your arteries. Taking D without K2 long term could theoretically increase arterial calcification. Why does this matter after 30? Vitamin D production in the skin decreases with age. Indoor lifestyles mean less sun exposure. And vitamin D deficiency is linked to increased risk of pretty much every chronic disease: cardiovascular disease, diabetes, autoimmune conditions, depression, and certain cancers. If your vitamin D is low, supplement appropriately and retest in 3 months to make sure you're reaching optimal levels. The fifth test is high-sensitivity C-reactive protein, or hsCRP. CRP is a marker of inflammation produced by your liver in response to inflammatory signals from throughout your body. The high-sensitivity version can detect very low levels of inflammation, the kind of chronic, low-grade inflammation that drives most chronic diseases. This is crucial because we now understand that chronic inflammation is the underlying driver of heart disease, diabetes, Alzheimer's, cancer, and accelerated aging. Standard blood work doesn't measure this. For hsCRP, levels under 1.0 milligram per liter are considered low risk. 1.0 to 3.0 is average risk. Above 3.0 is high risk for cardiovascular disease and other inflammatory conditions. But even within the low risk category, lower is better. Ideally, you want to be under 0.5. If you're at 1.5, you're average, but that still means you have more inflammation than optimal. Why does this matter after 30? Inflammation naturally increases with age. It's called inflammaging. But lifestyle factors dramatically influence how much inflammation you have. Poor diet, lack of exercise, chronic stress, poor sleep, obesity, all increase inflammation. The good news is that hsCRP is very responsive to lifestyle changes. Clean up your diet, exercise regularly, manage stress, improve sleep quality, and lose excess weight, and your hsCRP will drop. If your hsCRP is elevated, this is a wake-up call. You need to identify and address sources of inflammation before they cause irreversible damage. So, how do you actually get these tests? Start by asking your doctor. Bring this list to your next physical and request these specific tests. Some doctors will order them, especially if you explain why you want them. If your doctor won't order them, you have options. Many direct-to-consumer lab companies let you order your own blood work without a doctor's order. Companies like Quest, LabCorp, Ulta Lab Tests, and others offer these panels. You pay out of pocket, but it's often affordable. You can also work with a functional medicine doctor or naturopath who typically runs more comprehensive testing as standard practice. Get tested as a baseline now, then retest annually or every 6 months if you're making lifestyle changes and want to track progress. These numbers should improve with the right interventions. Here's the bottom line: waiting until you have a disease to take action is waiting too long. These 5 tests, fasting glucose and HbA1c, comprehensive lipid panel, comprehensive thyroid panel, vitamin D, and hsCRP, reveal what's actually happening in your body right now. They catch metabolic dysfunction, inflammation, hormonal imbalances, and nutrient deficiencies in their early stages when they're easiest to address. And they give you specific, actionable information you can use to optimize your health. Don't just accept everything looks normal. Normal isn't the same as optimal. Take control of your health by getting the right information. If you found this helpful, hit that like button and subscribe. Drop a comment and let me know. Have you gotten any of these tests? Were you surprised by the results? Thanks for watching, and remember, knowledge is power, but only if you act on it.